This is the Fix Your Sciatica podcast.
So let's talk about pregnancy. Today's guest is when I say very special guest, I mean truly a very special guest because she was the one who delivered our baby girl. And even in the early stages of pregnancy, meeting this guest has been such an honor. And every time I meet her, I'm just blown away by how brilliant she is. And she was really kind enough to take the time out of her day, on her day off, to share some of the big parts of pregnancy, especially from the pain management side, because I know that you pregnant mothers and mothers to be go through a lot. And I saw this with my wife as she was going through pregnancy. And although I know a lot from the human body standpoint and how to manage a lot of this pain, especially from a sciatica standpoint with a growing baby in the belly, I think it's also very important to be able to have the medical side, the physicians, the OBGYNs who can actually walk us through some of the restrictions and everything. So today I have Dr. Lizellen LaFollette, who is the most brilliant person I've ever met. So Dr. LaFollette, great to see you. Thank you so much for being on today's episode.
First of all, let me just say that it is a great delight to be able to your child. I think it was a great opportunity for us to know each other and to get to know each other. And let me say that I still am delivering babies 33 years in, and it still is an enormous joy. So what a delight, right? But I do think pregnancy is one of those examples in which it makes an enormous difference in terms of taking stock of where your health is and what can you do in pregnancy to make sure that you optimize it for this new human.
Absolutely. I even just watching it with my wife, Katie, it was really cool to see the evolution. Obviously, I learned about it in school, but I'm not have the ability to carry a child, so I don't know what to experience. So I know from a textbook standpoint. And so for the listeners who have just met you for the first time, give us a rundown of, your practice, everything, how you got to where you're at today.
All right, so I've been in private practice for 33 years in OBGYN in Marin County. Marin County being just outside San Francisco, and I do it sort of in a very small one-on-one way. I have a small practice, I have a midwife and another doctor, but it's pretty much hands-on. You see us prenatally, and you also see us in terms of our prenatal care and delivery, so it's both sides of this, which I happen to think is very, very important. I view pregnancy as the opportunity for a woman to take stock on where she is, what can she do to improve her health, what can she do to prevent injuries, and how she can get a training effect because she's working out in pregnancy, and how that will actually tie over in terms of postpartum, which I have to say, I think postpartum is the hardest thing a woman does.
Absolutely. It's, again, I'm so amazed, obviously amazed by this baby newborn, but also seeing my wife, my partner, go through this, give birth and recover and go and do all the workouts that she's doing. So let's talk about what a lot of the pregnant listeners are coming here for, which is pain. Now, there's obviously a lot of changes that happen in the body, right? And so the goal of this podcast was to always be better than Dr. Google, right? Rather than scratching the surface, taking a little bit of a deeper dive and trying to provide that true, in essence, understand that there is nuance, but being able to, provide some clear guidance for the listeners. So let's break down this pregnancy into the various different trimesters, right? And interesting enough, we have our first trimester, second, third, but then the fourth trimester, which is the postpartum aspect, which a lot of people, when I say a lot of people, we'll just say a lot of the general community ignores because we don't often talk about it, right? So here we are, we're going to talk about it all, right? So let's talk about the first trimester. It was okay, you confirm that you are pregnant and, here we are so excited, but there's a lot of changes in the body, right? And so let's talk about some of the, from a pain standpoint, right? There's all these changes from 1,000-mile view, and then we'll take a deep dive into it. What are some of the common pain areas that you see in that first trimester that patients discuss with you?
So I think part of it is taking the assumption that when you are pregnant, you are taking all your physical health and injuries into a pregnancy. So what happens at the beginning? And many women feel so unbelievably exhausted and so unbelievably out of their body in terms of diet and smells and odors make them feel nauseated that they don't feel like they have any control. Pain per se, interestingly enough, in the early part of pregnancy is not a dominant factor, except for you feel as though you're going to get your period and you don't get it and that the uterus is growing. But all of the other things that happen later, sciatica and all sorts of things that happen related to what's happening to the pelvis really do happen later. But the metabolic changes, which are so important in terms of your digestive system slowing down, you're more constipated, you're more tired, you don't understand why you were fine to eat X and now you can't even look at it. There are some really big changes that happen in pregnancy that may, for many women, take it completely by surprise. Those of us who are in OB feel as though if those are the symptoms you're feeling, that's a good answer because that means the pregnancy is good. And for people like me who believe in seeing people early so we can make sure that the pregnancy is where it should be and that it's growing appropriately, the ultrasound will make you feel, for many women, make them feel reassured that things are going the way they're supposed to, even if your body's not feeling that.
Yeah, it was. I remember that first trimester. It was like once we got our, the pregnancy confirmed. It was like, oh my gosh, my wife was a mess. She couldn't eat anything, and I remember we don't drink soda in this house, but it was literally literally one time where I went to the grocery store to just buy 7 Up ginger ale and like cream of wheat and oatmeal, like all this like stuff. And then I remember giving it to her, and she was like, "All right, I can kind of stomach this," but literally it was like 1 or 2 sips, and then she was done.
Yeah.
And that was unbelievable. And so if we were to look at and I'll tell you, one of the things that I would often see in the first trimester when I would see it from a patient standpoint, from a PT, is what's interesting is like when you're exhausted, like you can't leave your bed or your couch. And so it's a lot of like those body aches just due to inactivity that I have observed, as well as, interestingly enough, like if you're having that emesis, right? That nausea and vomiting. It's if you're keeled over a toilet for, a long period of time, your body gets pretty banged up. So I will say from a physical therapy standpoint, when patients come to me and say that, it's like, obviously, number one, make sure you're communicating with your OB. But I would often say in that scenario, I would just say this is kind of survival mode. Like you can't really do much, and you just kind of have to just go through it, right?
Yeah, I think that the idea of survival mode, the reassurance is that it's survival for two, right? So you're bringing in the next generation, which is a gift in itself. And you, the host, are going to take some hits. So I think one of the things we have to recognize is not all of the hits are something you expected. And so give yourself some kindness, give yourself some time. Recognize that if you look at the prospective exercise and pregnancy data, the people that are able to get their heart rate up may, in fact, get through the nausea phase faster, but they may be more tired on the other side, right? So, there's all sorts of things that, your heart rate changes at the beginning of pregnancy. You have all these changes that are sort of like physiological in terms of your bone, your blood volume and stuff like that. But the reality is that give yourself some grace. If you need to be eating French fries for the beginning, do not worry. The prenatal vitamin in itself is probably the hardest thing you're going to swallow in terms of nausea. And just if there's a way to get your heart rate up, you're thinking about getting the metabolic rate to clear the pregnancy hormone with some that you have some control of. You don't have a lot of control, but you have a little control. So I tell people keep moving if you can. Try to figure out what works because then I'm going to hold you to that throughout pregnancy because once you've established a pattern, your placenta and your baby expect that pattern and holding on to it to the end is the most important thing.
That's huge. Yeah. So first trimester, we're going to get through it. You're working for 2. We then transition into the second trimester, right? And I remember for us, the second trimester, it wasn't as bad. It was actually pretty decent. Like my wife was feeling pretty good. That was actually also the moment I started to see a baby bump start to appear, which was really, really cool. And then obviously, it's great to be able to meet with you and your team periodically as well, is because to be able to have that reassurance. Oh, I will say, partners, if you're listening to this on behalf of your pregnant partner who is not feeling great, from my standpoint, do everything you can to support them. And so if your partner says, I can smell the coffee from across the house, can you not go to McDonald's, go to Starbucks, go something, don't make coffee in the house. Same thing. It's like if you have to make your own meals, that's totally fine. Make sure it is not obnoxious. Do everything you can to just make your partner feel good because they're feeling not so great at this point. So I had to make that note.
Yeah, this is such a great note because one of the things is you're as surprised as she is, right? You didn't expect that coffee was going to be a problem. You didn't expect that she wanted to be eating French fries. This was coming out of nowhere. Odors and certain tastes, it's not the same. And luckily, it's a finite period of time. I tell people, usually by the time you're somewhere between 10 weeks and 14 weeks, things should start to clear. The hormones starting to go down. Your metabolism is starting to get used to this new rate of delayed gastric emptying. And so in general, you have sort of you have a break. And that's when, for me, I'm like, okay, what did your body used to do? What movement are you doing? What is safe? What do you feel good doing? My rule in second trimester is get back to what you did before. You either have to decrease the intensity and can go for the same period of time, or you keep the intensity and have to do it shorter. Those are your two adjustments. You will be able to change over time throughout the pregnancy because you're taking your weight over a distance, so you're getting a training effect. But start somewhere that you think you can handle and stick to it.
So let's talk about those aches and pains that can encounter. As you're bringing this up, I'm already having a couple of thoughts in regards to what I've experienced. But tell us, like in your practice, when it comes to that second trimester, what are some of the common things from those aches and pains standpoint that you see?
So now that the uterus, if you think about the uterus as it grows out of the pelvis, right? So it's now clearing the symphysis pubis, right? So in the front, and it's now starting to be an extra pelvic organ. So the first thing that a lot of people feel, somewhere around typically 17, 22 weeks, is around ligament pain. And they can't quite figure out what it is, but it can be very sharp on one side or another. And it gets into the attachments of the uterus are inside the pelvis, right? And so there are ligaments that were this long that now eventually going to get this long. So there's a stretching that's going on, and it can be quite uncomfortable. The uterus also has a tendency to sort of rotate to the right, so it's pulling more on one side. So some people feel it more on one side than the other. So that can be quite painful, and it's a surprise again because you're just starting to have a bump. And why are you feeling as though this big organ now is sort of pulling? And that can be an absolutely normal finding. It then gets into how you exercise related to that and how do you feel. In other words, there are many people that feel they want something to support them as they work out because it's starting to feel like you have more weight there and it's not comfortable. And my feeling is whatever makes you feel okay, you can't over tighten something on it, belly band or just compression, yoga pants, those all work, whatever works for you. And as long as you can keep moving. Because as you keep moving, the baby gets exercise, you get in better shape, your heart rate gets trained for the pregnancy and for the increased blood volume, and it's one of those things that's additive and positive.
Yeah, a lot of changes, especially things start to get bigger. And one question that brought up, I was so interested because you said the uterus often rotates to the right. So does anyone ever ask why does it rotate to the right versus the left?
It's such an interesting thing. It's one of those things in which I tell people we don't quite understand the structure of the pelvis and why we call it dextro rotated at the beginning. I mean, eventually it ends up, of course, being completely straight. But if you think about physical therapy and the inguinal ligaments and the attachment of the legs to the pelvis, and now you have this bowling ball in between, there's a lot of compression and shortening and lengthening that happens, not necessarily that anybody's doing it on purpose, but related to growth that I think is kind of important to understand. And so as a physical therapist, you have hands-on then, and you have a chance to sort of say, okay, look what's happening to the connection of your hips to the symphysis and to the pubic rami in the back. So all of the ischial tuberosity, the whole pelvis brim, right? How is that changing as the uterus grows out of the pelvis and starts to find its way in terms of what's the best center?
Yeah, that makes sense. And so the way I see it is like as the baby grows and everything has to move out of the way. And technically speaking, things move in the path of least resistance, right? And so it's like if there's a little bit more space, it can rotate to the right, which also means that if you're having a little bit more weight distribution to the right, you might have a little bit of a rotation in your spine and your pelvis to the right as well. So from a physical therapy standpoint, what I found what's interesting is the fact that from an injury and pain standpoint, it's like we kind of, when we get to that second trimester, pregnant mothers are like, okay, I'm starting to feel a little bit better. And I know, especially like coming off of athletics, getting back into shape is often one of the hardest things, right? But oftentimes we're thinking, okay, we can get right back and doing the things that we used to do. And all of a sudden, boom, we do too much, right? And so I really appreciate you saying managing both intensity as well as the volume, right? And so one or the other. And I think that it goes not just in pregnancy, but in life in general. We should be changing only one variable at a time, because if we change both variables at the same time, then we don't know what happened. It could have been too much too soon all at once, right? And so that was a big thing. And what I actually find is by this time, those aches and pains, especially we're looking at like possible some SI joint pain, some piriformis pain, even some of the sciatica type of stuff, and they're kind of all interrelated, right? It's like the butt and the leg going down. I find, yeah, those supportive bands are really, really helpful. Sometimes I'll take, they're like booty bands. They're like these like circular ones, and you just put them around the pelvis.
Right.
And it kind of just gives a little bit of a compression. And I remember when we were cleared to exercise, and I said, Dr. LaFollette, is there anything that we can or cannot do? And you said, actually, as a physical therapist, get her strong, but you don't necessarily have to tighten up the pelvic floor more, because we got to get the baby out eventually, right? Yeah.
One of the things that's so great about pelvic floor therapy, and there's so much now that we're hearing about, is everybody goes, well, I have to get to the pelvic floor person. I'm like, please, not now. Do it after, because I need to get that kid past those muscles. I don't want you any tighter. Now, one of my patients said to me, well, Lizellen, but what if I'm too tight? I'm like, I'm pretty sure you're too tight. It's your first baby. But not in a negative way in terms of a pathologic way, but in this idea that you have control of the pelvic floor as both a strengthening and lengthening, but not tightening. So part of that is the education of how do you do that, recognizing that head has to go across all those muscles to make it on the way out. And I'd like less of an obstacle, thank you very much, because, a head's already big as it is, right? So.
And I, back in 2020, said I got to expand my knowledge on this pregnancy and postpartum world. So I actually spent about 12 weeks, 3 months, understanding like pelvic floor and pelvic floor dynamics. Now, I don't do any of the internal stuff, but I actually found that what was really helpful was understanding this concept of tightness. Listeners, you might have heard this throughout other episodes, but tightness is actually, interesting enough, tightness is more of a perception. Restriction is more of an objective measure. So restriction is, can the muscle actually lengthen, as Dr. LaFollette was describing? Can a muscle actually lengthen? What's interesting is that when something feels tight, something can feel tight because a muscle can feel tight because the muscle is truly shortened in what we call in a perpetually shortened position. So that's what we call tissue restriction. But then we can go on the other end of the spectrum where a muscle is perpetually lengthened. And that lengthened sensation creates that tightness perception, resulting in us thinking, well, we got to loosen that up. And it's not just in pregnancy, but it's particularly important in pregnancy, because you're absolutely right. People are like, oh my gosh, I feel a lot of tightness in my pelvic floor. Maybe I should tighten up even more. But no, we got to get the baby out. Yeah. So I look at it as I like to call it pressure management. And so what that means is the fact that as the baby is growing and everything's starting to maybe move a little bit south and things are starting to expand, yes, things are everything is acting like a sling. So you're going to feel that perpetual tightness. Well, again, we have to let the baby come through, right? So what we can look at is, all right, well, what other structures are changing, right? And so ultimately what I find, especially as the body starts to grow, as everything starts to go down, we experience a lot of what we call diaphragm restriction as well. And so when the diaphragm doesn't have an opportunity to ascend and descend or breathe, and even in the rib cage as well as the lower back, if we don't have those muscles moving very well, it can actually create a lot of downwards pressure on the pelvic floor.
Yeah, because you've lost the ceiling. Yeah.
Exactly.
Yeah.
And so I find, especially in that scenario, we focus actually a lot on deep breathing, rib cage expansion, posterior expansion. So then that way we can minimize all that downwards pressure so we can ease up that pelvic floor tension. And I'll tell you, I remember learning about this, and Dr. LaFollette, I remember saying, this doesn't work. And then I was like, you know what? Let me introduce it to my patients and see if this is a real thing. and then wow, unbelievable. Right. And so a lot of changes. So, and then also in the second trimester, the mother's getting a little bit bigger, but not to the point where we're third trimester big, right? So I think the third trimester is probably where I see the most of my
Yes.
patients
Yes.
at that
Yes.
stage. So let's talk about the third trimester because
All
I
right.
think that should be a big chunk of
So
it.
to me, the third trimester is, symphysis pubis separation, sciatica, and all of the sacral iliac stuff. Those are the biggies. And let me say that for my own experience in terms of sciatica, it was absolutely, I got to a certain weight and I was getting sciatica on the left leg, right? So there is a weight relationship, and there's also a pelvic, the pelvic structures also in terms of the bony structures related to pregnancy. But one of the most important things in terms of preparation for birth has to understand all those integrations and how to make them better, because the baby's position is related to how all those structures accommodate to have the kid's head and back come down in the right way, right? So it's really important to understand the bony structures, the tendinous insertions, where the child is fitting, and how you can relieve the mom related to all that stuff. Because if you can, it's going to make a passage easier. And I would say in the 30 years that I've been in practice, understanding the pelvic structures as determinants of direction of where the baby is heading in terms of the way down, right? Where is the back? Where's the head? Is it in the right direction? Those things have become far more important than we were ever taught. And that never underestimate what a physical therapist can do to help you really direct the way the baby is fitting and help in terms of preparation for birth.
In regards to position, we have obviously head down and we have breech. In your experience with the patients that you've seen, do you notice a difference in pain presentation with babies who are breech versus babies who are head down?
Right. So, and I don't think about those as the only two positions. I want to know that the back is up too. So we can talk about that in terms of the head, because the back being up is so important in terms of the baby being posterior, the head being tucked in, and it therefore fitting in. But let's talk a little bit about some of the things that can happen in terms of a breech baby. If you think about a breech baby, the head is sitting either under the ribs on the right or under the ribs on the left, but it is really uncomfortable. It's a fullness that is, you will sometimes see women literally sort of trying to push down externally. And I'm looking at him like, oh, okay, is that kid breech, right? Because that's a head. The head is as hard and as big as the butt, but when it's high, it's more uncomfortable. And so, yes, I think women in general, when they have a baby that's heads up, they really do notice that, especially at the end. And they will tell you, or they will show you what are they feeling, because it's this big round structure that's really too high.
Yeah, and I would say with the patients that I've worked with who have had a breech baby, I do see it. It's amazing. I'm just like, wow. And from a pressure management standpoint, what I would often do is really again focus on that expansion, really trying to create more room, right? Like in essence, what was really interesting is that as we were going through these birthing classes at the hospital, they were talking about this. They talked about the position of the baby, and I was like, I didn't know that. I just thought that my wife goes into the hospital and she starts pushing, and that's it. I didn't realize the baby had to. I knew, obviously knew the baby had to be head down, but didn't realize that they had to rotate. And so hearing about this whole spinning babies thing and being able to create room and create space for these babies to rotate into the right position, what was really interesting is I was going into that to make sure that our baby was coming out the right way. I realized a lot of their techniques are actually a lot of the techniques that I use in my practice.
I'm so
To
sure.
be able to create
Where's
space.
it coming from? Where's it coming from? It has to be coming from physical therapy, right? And what's so
Yeah,
amazing is how long did it take to take things that you're doing every day to people that are pregnant and not pregnant, right? And that
yeah,
we finally are able to, in obstetrics, go, now hang on a second, maybe the bones and maybe the tendon, maybe the, hello, you think? Of
yeah.
course, there's, the passenger and the pelvis and all of the structures that make the difference in terms of being able to not only carry, but also then deliver. And the lack of understanding of the physical nature of the pelvis and the bony structures and the tendons and the, everything that'll allow a kiddo to come the right way through is, well, they call it spinning babies, but it really is physical therapy for the pelvis, right? It's really taking advantage of all the skills that you've always used to make a difference. That has been an enormous gift, I think, from the physical therapy world into the obstetrics world. Because if you think about it, we want to maximize the chance of having a vaginal birth, right? That is our goal. It's the safest, it's the best for the baby. It makes a difference in terms of everybody's recovery. But for many women, the physical aspects of being pregnant and the change that happened to the pelvis really need to be addressed by somebody that does that for a living, right? And that is not something that obstetricians typically have been trained about.
This episode is brought to you by the Patient Advocate Program. Are you tired of not having support between your rehab sessions? Introducing the Patient Advocate Program, and we're focused on your recovery, and we're offering you 24/7 access to a doctorate of physical therapy. Stop waiting in line to be seen and stop spending hours doing long exercise programs. Imagine being able to get all of your care delivered straight to your phone. Best of all, it's affordable. We believe everyone deserves top-notch relief without breaking the bank. So why wait? Take control of your health today and visit ptpatientadvocate.com and book your free call with our experts.
And I'm glad that the physical therapists were able to, kind of help and, come into this partnership. And so if we're looking at this, here we are at the third trimester, baby's really big, running out of space. I think, the listeners out there, if you're in your third trimester, you're probably in these positions right now where like the baby's forward and like your back is going to have to arch. In some cases, you're probably waddling around a little bit because like one, you don't want to fall over. And so what's interesting is that for the most cases, our feet end up getting turned out as well. It's kind of and it's not no fault of your own. You're doing everything you can to make sure you don't fall over, right? And so it is important to make sure that you don't fall over. And I think what's really interesting is that you'll have mothers who probably have the most intense S curves, the most toed out feet, and they have no pain whatsoever, right? And then you look at another mother who's in the same stage, maybe has a slightly less degree of a curve, maybe slightly less toed out, but they are in agonizing pain. And so I think what ends up being very, very challenging, especially in a world where we can be so rushed that we are often just trying to treat like what we see on a piece of paper versus treating the person in front of them. And so for the listeners out there, what I would say is the fact that pain itself is an experience. That means that it's something that we perceive and we go through. It's not necessarily indicating that there's some sort of damage. That means that there's probably some sort of change that's going on. And I went from you're in pain because X, Y, and Z is damaged, we need to fix it, to this is a little irritated, it's not so efficient, let's make things a little bit better. And then if that's the case, if your posture is exactly what we need to, let's address your posture. If you need support, if you need those exercises. But what I found particularly, and you probably experienced, and I know especially as we got towards the end of the pregnancy, how overwhelming everything was. It was like, okay, we're going to get ready for the baby being born. We have our registry, we have our baby shower. Oh my gosh, am I even prepared? And so I think about that, my experience, and I apply it to the patients that I work with now. And I think, all right, well, the last thing that these expecting moms need to have is a 37-item exercise program on top of everything that they're doing, right? And so I realized that simplicity is better, knowing that you're going to have someone there to like help you, right? But yeah, that's one of the biggest things. It's like, if it is your posture, we can make some slight changes to your posture. I often also find, Dr. LaFollette, that from a pain management standpoint, borrowing what you said when I think it was like the second time we met, is do what feels good. And I think that's one of the most important things is, and this is how I approach it in just pain management in general, is I'll say, well, if you sit and you cross your leg over your other leg and your pain goes away, do that as often as you can. That is exactly what you need. So thank you so much for applying that in that standpoint. So
but I do think one of the things that's interesting is as the pregnancy evolves, as the weight changes, as the baby gets bigger, what used to be fine may not be. And so you need to stay flexible and give yourself some grace related to that felt great before and now I'm feeling terrible. And this accentuated lordosis that you're talking about because here's the weight of the baby that's pulling you this way and your spine is going. So this whole, what's that doing to the SI joint, right? You need to figure out, do you need to lie flat on the floor? Do you need to actually try to get against the wall? What are the ways that you can stretch that shortened back muscles now that are holding on to this in the front, right? So those are things that are really important. And I always tell people there are 3 joints in the pelvis, right? There's the symphysis in the front and there's the 2 SIs. So we need all of those guys to be aligned. And I think it's very tough. If you don't have somebody else helping you, it's really tough to understand what's going on. And when somebody comes in and says, I have sciatica and I have low back pain, I'm like, okay, let's break that down. What, where, how, what do you notice? Who are you seeing? Who's your body worker that's helping you? Who is actually trained to understand the physiological changes of pregnancy? And are you getting the right help? Because if you go to somebody and it doesn't feel better, guess what? That person's probably not helping you.
For sure. And it absolutely is important to have a team. I mean, your body's going through a lot of changes now. Having a support system, that's why it says it takes a village to be able to manage through. Let's talk about like birth and then the 4th trimester, right? Because that is a very interesting time. A lot of changes happen. Not only like being in the hospital, but then you leave the hospital as a family of 3 or more, that's really, really something. So tell us a little bit more about, let's talk about like the birthing.
Right. Okay. Let's talk about birth. So when I'm looking at somebody that I'm going to deliver, the last month I want to know, where's the baby's head? Where's the baby's back? How's the mom doing? How big do I think the kid is? Okay. I want to know all that. And I want to know that for the last month because it should be pretty steady. It shouldn't be changing in the last month. So usually, in fact, always, and really related to experience, that even though people think they know the head is down, unless you actually put an ultrasound on the belly at 36 weeks, you can get it wrong. And you don't want a surprise when you're in labor that all of a sudden there's a baby who's breech. So my rule has been in my office a month before the baby comes is to figure out where's the head, where's the back, how big is the kid, how much fluid is there, and then how can we make sure that that stays put. So that is really important because if I find that the baby is sort of, the back is ordered to the side, or actually the back is against the mom's spine, those are things that a physical therapist can change and can help me with. And that is where the spinning babies, which is really physical therapy applied to a pregnant mom, right, can help.
Absolutely, yeah. So position is important. All right, so here we are. Baby's born. Right. And baby's born. I'm just going to put it out there. I think the first 2 weeks post baby being born, it goes by like a blur. So whatever pain you experience, it's literally you're in survival mode. You'll just get through it. Right. And that's where it's like you have a new baby trying to figure out like how to sleep, how to feed. You go through your first couple pediatrician's appointments. You go see, your OB, Dr. LaFollette. Okay, great. 2-week checkup. And then let's talk about that postpartum phase and what are some of the big pain experiences that the mothers feel at that stage.
Well, I think there's 2 parts. I think to go a little bit back to birth, look, birth is a finite amount of time, right? Even though we spend an awful lot of time talking about it, in a normal first-time mom, it's 12 to 14 hours. So you prepare the best you can, you bring everything that you can, you make sure you have as much as you can in terms of support system. And then there's an element of letting nature take its course. So assuming that that has happened and you've had a vaginal delivery without a lot of complications, which is exactly what we plan on, how the heck are they letting you go home with a newborn? You have no license. You've never done it. You don't know how to feed the kid. I mean, it's really an incredible ask. An incredible ask. And that's only talking about from the baby side. I mean, the parents are like, what are they doing? They're letting me have a baby home? I mean, I don't even know. So there's 2 elements that are sort of on the survival mode that you talked about. 1, just focus on feeding and sleeping and eating. Those are the 3. Don't make it complicated. Feeding, sleeping, eating. I'm talking about for the baby, for you, and for your partner. Okay? Everybody's in. I tell people the kindness that you can do for a new mom is stock their refrigerator and get the heck out. Don't entertain. Don't ask to hold the baby. Don't take cute pictures. Get out of there. Let them find their way. Everybody tries to help, but then they end up staying, and the mom gets paler and paler and paler as she's so exhausted from the fact that she just had a baby and she had a blood loss and she's trying to figure out mobilization of fluids and figuring out the breastfeeding. It's like nobody needs to be entertained. Feed them, get out. When you get to the second week, and why do we see people at 2 weeks? Because at 2 weeks, presumably the baby's actually close to birth weight now. You've figured out the latch in terms of the breastfeeding thing. You're bleeding less. You're less sore from the delivery, physical delivery itself. And God forbid you might have had 4 hours at a stretch in terms of sleep. So good time to touch base and make sure you're not completely coming unglued. Now, I also ask people to get an hour of sunlight a day. It's not a big ask, but you're surrounded 24/7 with a crying child who you don't even know how to make them feel better. And you're overwhelmed by the fact that how long are you going to be in this absolute cauldron of crying and pooping and eating and starting over, and when are you getting a break, and when are you getting in the shower, and when are you able to actually do anything for you? I mean, it just is a crazy time. And so an hour of sunlight, in the best of all worlds, an hour of sunlight without the baby, so you realize that, oh my goodness, everybody else is still having coffee and doing all the things that their life was before, and your life is upside down, but it won't be forever. That always makes a difference, and especially where we live. My goodness, Ashley, look at it. I mean, if you can get an hour of sunlight, it's going to help everybody's mood. And recognize that this crazy 24/7 scenario is not going to last forever. And I also feel that it's nice to move. So if you can get out and walk, you're not at this point going to start do hill repeats, for crying out loud. But start with simple stuff that'll get you out and it'll get you some mobility to try to figure out, okay, how am I feeling? Wow, my uterus is way smaller now. How do I feel about my pelvis? How do I feel about my sciatica? How do I feel about my hips? Right? Because all that can get rearranged with birth. So those are things to really touch base with and to understand that pay attention to what's going on there. And then from the second week until the 6th week, when we see you again in a month, a lot of things can happen. You can expand your circle. You can figure out whether you want to walk longer. You can figure out, whether you're sleeping better, whether you're getting better nutrition and stuff like that. But it's an enormous transition, and it's a big ask. And it's a big ask for people that really, for the most part, have never done it. And if you think about the disjointed societies that we live in, and if we were in a third world country, you'd have your grandma and you'd have your great aunt and you'd have 10 other people that could help you, right? But that's not the way we live now. So it's really tough. So you have to be very careful to each other as partners and to the baby and to whoever is in your small circle of support, that those are the people you count on. And they shouldn't be offended if you tell them, look, I'm going to sleep right now. I really can't have a conversation. I need to be focusing on my family.
100%. And I have to thank all the folks who came to support us when our baby was born. And yeah, at that time, it's like, don't be afraid to ask for help, but then also don't be afraid to say, it's time for you to go, right? And I think that's really important. And yeah, those first 2 weeks kind of went by like a blur. And as you start to get a little bit more into the groove, you can then start what I realized that during those first 2 weeks, especially as myself as the father, was everything was baby. And I was just like, let me make sure I'm eating, let me make sure I'm sleeping, and let me make sure, make sure mom's fed. I can't feed the baby, right? I got to make sure that I'm eating, I got to make sure I feed mom. And then the learning curve, changing diapers and swallowing, all that stuff. Once you start to kind of figure that out, which I was really surprised that I was telling my wife, I was like, you know what I don't miss? I don't miss the learning curve and just kind of like figure out how to diaper a baby or all that. Now I'm excited because now I'm a pro at it. Yeah. But I will say is once you're out of that and once you start to learn to get into a rhythm, you can start to say like, ooh, what am I experiencing, right? And so what I would often say, usually like within the first 6 weeks, those 6 weeks kind of go by like a blur. If you're experiencing pain at that standpoint, whether it be sciatica pain, back pain, or neck pain, look at how you're positioning yourself. I'll premise with, we had I think it was like a 48-hour labor, and my wife pushed out 90 minutes, total rock star, right? But then like the 3 days after, she was like, my arms are killing me.
Yeah.
It was interesting. At first I thought, man, okay, maybe her arms are really sore because she was gripping her knees. And then finally my PT brain kicked in. I was like, oh, her neck is really messed up. So then, and then once we fixed that, I realized, oh, well, she's looking down at our daughter every time she's breastfeeding. Oh, this makes it worse. I was like, okay, let me start sprinkling this in, right? And so positioning, if you realize, man, my shoulders are killing me, my neck, my back. Okay, maybe we can make some changes on the breastfeeding standpoint. So what I found, and I did a podcast about this, was
This is
we
so
were a
good.
huge fan of the My Breast Friend, which is a great breastfeeding pillow because our daughter was a little bit in the smaller size. So when she used like the Bop It like packing peanut, she fell right through. So we
Yeah.
used a bigger one.
Fall
Man,
right through.
was it huge? And then I realized a large part, and now obviously your body has gone through a huge change, so we can address that from a physical therapy standpoint, stretches and everything. But especially at this point, it is important in the postpartum phase to keep things really simple. It's really easy to make things overcomplicate, but when you overcomplicate things, you're not going to do it. You're just going to feel overwhelmed. I would also say, like, take a little bit of a break from social media because you'll go on and you're going to be given everything about this is what our kid did at 4 weeks, and then you see and you're like, my kid's not doing any of that. Like, ignore that stuff. But being able to focus on positioning, I think, is huge. And I'm going to post a couple videos on like how to carry your baby, how to bend over and put your baby into the crib. I think that is actually really important because once you are able to focus on that, the pain is going to be a lot less, which I found to be extremely helpful. And yeah, so usually at that 6 week mark, circle opens up and start doing a little bit more. What I find is, well, I guess for you, Dr. LaFollette, do you find that like mothers, once they get to that 6 week mark, they're able to start to do a little bit of something? Are the aches and pains usually associated with doing too much or not doing enough? Where did you see that?
Well, I mean, your biggest point. So the three things that I see postpartum that you described, at least two of them, are how do you deal with a breastfeeding kid for your own back, shoulders, and wrists, right? I remember going in to see my OB and going, I'm holding the baby like this and my wrist is killing me, right? Because you're not paying attention to once the kid's on, you got to let go of your shoulders, you got to let go of your neck, you got to let go of the wrist that is cocked now. And so carpal tunnel can happen and, all these other things that can happen to your hand, right? So, the positioning, if you think about the adding the little bit of physical therapy that you were doing at the 2 week mark and beyond, the more you can be aware of your own body, once you're able to get the baby on the breast, you will help yourself in terms of the pain because that is a repetitive motion if you think about it, Ashley. And that repetitive motion, if you're not doing it right, isn't going to help you. So I think the first is understanding what positions you're putting yourself in that are new and making sure you're correcting them. And I think that's hugely important. The other thing has to do with once you start to understand that you're feeding and then you're going, you're not feeding continuously for 24 hours, that the movement that happens after you're done breastfeeding, which is, of course, the best time you can go because you're less full, right? So it's going to be the best time that you can actually sort of go if you want to do exercise and stuff like that. There's a freedom about being able to recognize, hey, I'm feeding this new human and I'm getting myself to move. I mean, talk about a win-win, right? I mean, it's brilliant. So whatever you can do, make sure that that's something that you can incorporate because the endorphin rush from getting your heart rate up by moving again after you've done that is huge. And it sets you back from the pain question. Because if you can get your own endorphins to deal with what else is happening, if you're having somebody pay attention to your posture and where you're holding on, that's going to make the biggest difference in terms of sailing through the rest of the postpartum part.
100%. And so give yourself an opportunity to move. Yeah, 100%, Dr. LaFollette. This is huge. And so you said earlier in this episode that pregnancy and birth is this finite period of time, right? And so today is going to be primarily the pregnancy and postpartum, but you also do amazing work across the entire lifespan of women. And so I'm really looking forward in the next couple of weeks that we actually talk more on the later stages, the menopause, perimenopause stages. And so for the listeners who have gotten some really great insight and are very excited and intrigued by the work that you do. Can you tell the listeners about how they can get in touch and hear more about the work that you're doing for women's health?
Yeah, so if you think about the life of an OB, right? We start with birth. Well, we first start with birth control or the lack thereof, right? Then we deal with birth, and then we deal with menopause and postpartum and menopause and postmenopause and longevity. So if you think about a career of an OB, it encompasses it all. I mean, it's sort of a brilliant thing, right? It literally starts from seeing a teenager all the way through, right through to the end of their lives. I have a private practice. I'm in Marin County. I'm drlafollette.com. It's easy to find me. But the stuff that I'm really also now working on in addition to the pregnancy stuff is menopause and hormones and understanding what are the risks as we age that are going to make a difference in our lives. How do we expand our health span? If you think about pregnancy, it's sort of the 10 months in which you as a woman can get yourself into the best shape of your life, right? Because you are carrying the next generation. Well, imagine what happens at midlife. You are now done with the reproductive part and you are expanding that 10 months to 50 years. Right? In terms of being able to move and be able to think, to be able to do the things you want to do, to be able to work and to feel as though you're physically active the way you want to be. There are some really big issues that happen in menopause, but all of it's on the basis of you want to continue to expand the health span. So there are many things that are coming up. I think AI is a very exciting time for us to be able to look at data and understand proteomics and all these wonderful new metrics of sort of the metabolism of life and longevity. But there's also some simple things, and movement is one of them, that'll make a difference for all of us as we age gracefully, as long as we want to be on the planet.
All right. Yes. 100%. And I'm excited to talk even more about that in a future episode because we can talk all day about that, which is so fantastic. And so listeners, I'm going to put her information into the show notes. So if you didn't get a chance to write that down, you can go ahead and click on it. Dr. LaFollette, it's been such an honor. I'm so glad to see you again.
Thank you. Right back at you. I'll do it again. Looking forward to it. Bye.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.